Is turmeric actually a natural miracle worker, or is it just overhyped internet noise? In today's episode, I'm cutting through the noise with real clinical science. I'll be breaking down how turmeric compares directly to drugs like ibuprofen, its hidden superpower for gut and brain health, and who should never take it. I'm also going to be diving into the hidden contaminants hiding in cheap brands of supplements so that you know which products to stay away from. Stay tuned. I'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's Zone. Today we're diving into turmeric, and as always, if you want the show notes, the slides, the graphics, the research studies, comment turmeric below and I'll make sure we send them to you. Let's dive in. So, what is turmeric? It is a compound derived from the rhizomes of the curcuma longa plant and a member of the ginger family. So if you've ever seen ginger before, it's a little root vegetable. Turmeric looks almost identical, only when you break it open, instead of being kind of white to off-white in color, it's extremely orange on the inside. It's native to Southeast Asia and the Indian subcontinent, where it has been cultivated for thousands of years. A staple in culinary traditions and a critical component of Ayurvedic medicine due to its health-promoting properties. If you've ever had curry before, you've most likely had turmeric. Curcumin, which is sometimes used interchangeably with turmeric, is one of the main active ingredients in turmeric. There are numerous amounts of plant-based chemicals in turmeric. Curcumin's the one that's probably the most well-studied for its medicinal benefits. It's a polyphenol with potent anti-inflammatory and antioxidant effects. Okay, so different functions of turmeric. It's used in cuisine, in cooking world. It's known for its warm, bitter taste as well as mustardy smell. It's a key ingredient in curries and is used for coloring and flavoring in many Asian dishes. For medicinal use, turmeric has been used to treat conditions ranging from colds, inflammation. Its application in Ayurveda and traditional Chinese medicine spans the treatment of pain, inflammation, gastrointestinal issues, and now we're seeing turmeric being studied for so much more, which is what we're going to be talking about today as well. Okay, so if we break down some of the broad categories of the health benefits of what turmeric can help support. So number one, it's been researched and studied for its anti-inflammatory properties. As you see here, research suggests that the curcumin in turmeric suppresses molecules known to play major roles in the inflammation cascade. Molecules like cyclooxygenase and MAP kinase have been studied as it relates to curcumin. We know it has antioxidant effects. We also know that studies show that curcumin, its effects on inflammation and oxidative stress may protect against common conditions like Alzheimer's and dementia, as well as cancers. We know that it has cognitive and mental health impacts as well. There's emerging evidence that shows that turmeric may boost brain-derived neurotropic factor, offering potential protection against dementia and depression. So let's dive into some of these mechanisms. Now, there's a lot of research, and what I've done is I've pulled for you some research and some diagrams to help you better understand some of these mechanisms that turmeric can provide. So if we look here again, turmeric is the source of these compounds called curcuminoids. And so if we look at arthritis, we know that it has anti-inflammatory activities. It regulates these enzymes called kinases, which play a major role in inflammation. And there's a number of research studies that have shown that turmeric, when you put it up against drugs like ibuprofen and acetaminophen, Tylenol, that it actually works as well and in some ways works better. And we'll talk about that here shortly. We know that with neurological disorders, it has an anti-inflammatory activity that regulates oxidative stress, reducing neuroinflammation, maintaining mitochondrial function, but also regulating the production of the neurotransmitters dopamine and serotonin. Remember, a lot of the medicines used in allopathic medicine target the preservation of dopamine and serotonin. And so again, curcuminoids have been shown to regulate these neurochemical productions. We know it plays a role in cardiovascular disorders. Again, you'll see this term a lot: regulation of oxidative stress and anti-inflammatory activity. But we also know that curcuminoids can regulate the apoptosis, which is just a fancy way of saying controls how cells kill themselves to make new cells. And so apoptosis is also an important regulator of cancer and cancer processes. Metabolic disorders, again, anti-inflammatory activity. We see these repeating regulating kinases. And as far as diabetes, helps to regulate the release of insulin, helps regulate glucose levels, and acts as an antioxidant and anti-inflammatory. So a lot of different tissues that can be impacted by curcuminoids. Let's look at this next one. This is interesting because beyond the antioxidant and the anti-inflammatory effects, we know that curcumin also has an impact on different types of bacteria. And so one of the ways that it impacts is through what's called biofilm disruption. Biofilm disruption. So if you look here, let's zoom in on this image, make it a little bigger here. You can see here these little yellow items. These represent bacteria. When bacteria get together, they form colonies. When they're in colonies, they produce this structure around the colony. It's like the moat and the gate around the castle wall. It's called a biofilm. It's what bacteria produce, again, as an agent of protection. And so when biofilms are present, it makes it much more challenging and difficult for antibiotics to work. And this is one of the mechanisms behind antibiotic resistance. It's when colonies of bacteria and other microorganisms form these biofilms to protect themselves from your immune system, but also from any kind of medications that you might take. Well, what we know about curcumin is that it has the capacity to break down biofilm, and that's what you're seeing over here in this last section. It is disrupting that biofilm, thus breaking those bacteria out, making them more susceptible to your immune system or to any kind of medications that you might be taking. Now that we know that it can bust out and break down biofilms, there are other antimicrobial impacts of curcumin and turmeric that we want to discuss. One is it's been researched and studied that it can aid in inhibition of bacterial cell division. So it slows down their ability to make new bacteria. We know it can inhibit quorum sensing dependent virulence. Quorum sensing is the way that these types of microorganisms communicate with each other about growth. We know it inhibits different species of gram-negative and gram-positive bacterial growth. And I see this a lot where you get these gram-negative, especially with these gram-negative bacteria that colonize people's GI tracts. And these bacteria can be linked to liver damage and to joint pain and rheumatoid arthritis and other autoimmune forms of illness. These are bacteria like Pseudomonas and Klebsiella. Well, again, we know curcumin can impact their ability to grow. We know it can inhibit the bacterial SOS response, and we also know that it can disrupt bacterial cell walls and cell membranes. So it can break through those cell walls and cell membranes, again, lysing the bacteria, destroying it. So a lot of different capacity for curcuminoids to impact microbes. And this is one of the reasons why historically in Ayurvedic medicine, curcumin has been used and turmeric has been used as an agent in intestinal inflammatory diseases, in gastric inflammation and intestinal inflammation. Now we get to some of its anti-cancer effects. So you can see here, curcumin has an apoptotic effect on cancer cells. What does that mean? It means programmed cell death. So it basically instructs cancer cells to kill themselves. That's what apoptosis is. And we know that this herb has that potential. We also know that it blocks angiogenesis. What does that mean? Angiogenesis is the formation of new blood vessels. So when a tumor forms, it likes to grow blood vessels. That's what you're seeing here. It likes to grow new blood vessels so that it can spread and those cells can spread and grow out. And so again, this is blocking that process, producing or reducing rather tumor cell invasion. We also know that it blocks tumor cell metastasis. So the way tumor cells can move to other parts of the body and potentially cause tumors to form and create issues. We also know that it can inhibit a number of different metastatic or pro-metastatic factors. So these are chemicals that help cancer cells potentiate and grow. And we know that this, again, that curcuminoids can affect and impact those metastatic factors. So a lot of research now coming out on the impact of turmeric on cancer, especially studies that are being done in animals, studies that are being done, what are called in vitro studies, as well as human studies now coming out. If we look at the research on this, we'll call it superfood, if you will, this is a review paper looking at, over time, the amount of research that's been done on turmeric and curcumin. And so what you can see here, not a lot of research. We go back to 1986 and kind of all the way up to 2006. There's really not a ton of research being done. But all of a sudden, you see here around 2007, there's this giant influx and increase in research. And so you can see how this map is color-coded here, the research being conducted on curcumin in metabolic disease, as well as non-alcoholic. This kind of dark orange represents non-alcoholic fatty liver disease. That's this segment here. And then you can also see musculoskeletal disease. That's this gray segment, and GI tract disorders here, as well as cancer, which you can see here in green. And then we also have neuropsychiatric disorders in yellow. So again, a lot of new research is coming out on curcumin in the last 20 years or so. We're seeing more trials, and these are including human trials. And so those are some of the things that I want to discuss and kind of point out today as well. This is not intended to be a comprehensive review of every trial or every study that's been done, but I want to point out some of these. So you can see this is curcumin supplementation in human disease. This is a review of different clinical trials that have been done in humans. So you can see here they did a scoping review conducted to assess human clinical trials reporting oral curcumin and other oral supplemental curcumin effects on disease outcomes. You see almost most of these associated on obesity and metabolic disorders, and then coming in musculoskeletal disorders where inflammation is a key driver, and beneficial effects on clinical outcomes and or biomarkers were reported for most situations. And a lot of these studies are double-blind, randomized, placebo-controlled trials, right? What they call the gold standard of medical scientific evidence. So that being said, let's look at some of these. Here's research on the efficacy of turmeric extract of curcumin for alleviating the symptoms of joint arthritis. And again, this is another review. In this study, the conclusion of the review of randomized controlled trials provides scientific evidence that supports the efficacy of turmeric extract at about 1,000 milligrams a day of curcumin in the treatment of arthritis. Now, I want to show you this diagram that shows some of the biomarkers that improve and that are being measured and that show improvement. So what you're looking at here is, in this kind of light orange color, you're looking at the placebo group. In the red color, you're looking at low doses of, and that low doses, that's 250 milligrams of complete turmeric matrix supplement. And then we have a high dose group taking 500 milligrams. And so what the two primary things being measured, or primary outcomes being measured here, were C-reactive protein and rheumatoid factor. And again, both of these are markers for patients that have autoimmune arthritis, particularly rheumatoid arthritis. And so what you can see, and then this third marker here, erythrocyte sedimentation rate, which is a marker for inflammation, just like C-reactive protein. So in the placebo group, you can see 29.6% improvement taking a placebo pill. But in the low-dose turmeric group, you get 81% improvement over the baseline, and then, 88.1%, and then in the higher dose group, you get 88.6% improvement in erythrocyte sedimentation rate. And so this is what does this translate into? What does that mean? That means when you get an improvement in ESR, that means that translates into a reduction of inflammation. Remember, turmeric has anti-inflammatory properties. And the C-reactive protein marker for the placebo, they got worse by 11.3%. In the low dose group, there were almost 30% improvement, and in the high dose, there was 51.2% improvement from baseline on C-reactive protein. And then we see something similar over here in rheumatoid factor, 13% regression in the placebo group, whereas an 80.2% improvement in the low dose group and an 84.2% improvement in the 500 milligram a day turmeric curcumin group. So again, clinical biomarkers that are commonly used by rheumatologists and other types of doctors to measure the progression of disease in autoimmune arthritis. So the review of trials, human trials that is, on using turmeric extract as a potential to treat arthritis are very promising and very good. I see this very frequently in my practice, where turmeric is commonly used as a natural anti-inflammatory when we're trying to get people's diet and lifestyle under control. Because remember, you can take turmeric supplements, you can take curcumin, but if you're not addressing why the inflammation exists, you're using the supplement as a mediator of inflammation, but you're not really figuring out why you have the problem. So again, the point of that is, if you're using the supplement to reduce your inflammation, you should also be simultaneously looking for the origin of why your inflammation exists. Now, this is a review paper published in Frontiers of Nutrition here recently on different human trials that were studied in different types of cancer. And so you can see here prostate, head and neck cancer, breast cancer, pancreatic cancer, as well as colorectal cancers, human trials, and all of these things that showed good results. And you can see that in prostate cancer, 0.1 grams, which is 100 milligrams rather, a day for 6 months, reduced serum PSA. That's with curcumin use. We see head and neck cancer. You've got curcumin inhibited the kinase activity and interleukin-8 levels in head and neck cancer patients. Again, this is a reduction of inflammation. In breast cancer, 6 grams a day for 3 weeks, recommended dose. And clinical responses were definitely observed in these patients. Pancreatic cancer, there were improved outcomes in pancreatic cancers using a mixture of different chemotherapeutic agents as well as curcumin. So, and in this study, you can see, look at the dosing here, up to 8 grams a day. So, if you go over the counter and buy a supplement that contains curcumin, most pills are going to contain about 500 milligrams per capsule. These guys were using 8 grams, which would be equivalent to about 16 pills a day. So that's a big load. And in some of these trials, what they found was, because it was so many pills, that the actual compliance rates went down, but still good results. And then you can see down here with colorectal cancers, you've got anywhere from 0.4 to 2.2 grams a day for 4 months. And then in some of these as high as almost 4 grams a day for months. All of these showing positive clinical outcomes and positive clinical benefits in folks with colorectal cancer. And again, these are human trials, not animal trials. So what a lot of these researchers are saying, when they're publishing their work, is they're saying we're seeing better outcomes and better results, but they're also saying we need more research. In other words, there's not enough pooled data for them to confidently say everyone with this type of cancer should be on, curcumin extract as a method of helping fight that cancer. You can see here, curcuma longa and curcumin affect respiratory and allergic disorders. And so you see the preventative effects of extracts of curcumin were shown in experimental animal models of different respiratory diseases through antioxidant, immunomodulatory, and anti-inflammatory mechanisms. Curcumin also showed preventative effects on some lung disorders in the clinical studies. So again, we've got human trials, we've also got in vitro trials or in vitro studies. So both, there's evidence that, that curcumin is an anti-inflammatory, antioxidant, anti-cancer, has mechanisms in all those different ways, has antimicrobial effects, all types of trials, both animal studies, both petri dish studies, as well as in actual human trials. So the growing research and evidence around curcumin is becoming more and more common. We're seeing more and more benefits showing up in these clinical trials. And so it is definitely something, if you struggle with any of these types of conditions, you might want to have a conversation with your doctor about whether or not, taking a curcumin extract is going to be something that might be right for you, or in the case of something that might help you. Now, one of the questions that comes up frequently is, or concerns that comes up frequently, and this is especially true of those of you that have a history of kidney stones or have oxalate issues, because turmeric is a high oxalate plant-based food. But I want to point out some of the things, because a lot of people are fearful of using curcumin, and the studies actually show that using a concentrated curcuminoid type of supplement does not contain large quantities of oxalate. So let's break this down. 1 gram of whole turmeric contains about 20 milligrams of oxalate. Now, if you're trying to follow a low oxalate diet, that generally means that you're trying to stay under 50 milligrams of oxalate consumption per day in your diet. And so if you're consuming a gram, and a gram's not very much, we're talking about whole turmeric. So we're talking about whole turmeric powder or turmeric food itself is a very high oxalate hit, because 1 gram contains about 20 milligrams of oxalate. However, oxalate levels are much lower in standardized turmeric supplement products. It's important that you understand that difference, because many of you have been scared away from using turmeric for this reason. So using large amounts of whole food turmeric can potentially elevate oxalate levels, and there have been research studies that have shown that. Using standardized supplement doses at 1,000 milligrams a day or less equates to less than 1 milligram of oxalate. So if you were taking a supplement and you were taking 1,000 milligrams a day and you were trying to stay under 50 milligrams a day, that supplement would equate to about 1 milligram or less per day of total oxalate exposure. Not a high amount. Now, there was some research done a while back that somebody, I can't remember who it was online, talking about it, but again, it put a lot of, in my opinion, unnecessary fear on people. This is total soluble and non-soluble oxalate content. This is a research study where they're actually analyzing it. And you can see here I have highlighted turmeric powder, again, which is a whole food form, can contain total oxalates of almost 1,900 per 100 grams. So that's, again, this is per 100 milligrams per 100 grams of total oxalate. So again, we're talking about much lower doses than that, and not using food, but using standardized supplements. As a matter of fact, there was a supplement company, I think it was last year, that came out and actually tested their products and found that their 1,000 milligrams of their product contained, it was somewhere like, I think it was like 0.44 milligrams of oxalate. So bottom line here, if you're considering using curcuminoid supplement as an anti-inflammatory, don't fear the oxalate. Now, if you're doing things like taking whole turmeric powder and making golden tea or using an abundant amount in your cooking or your food and you have an oxalate problem, that's where you might run into trouble. But again, if you're using the supplement, not so much of a risk. Here's that study I was referencing a moment ago, and you can see the consumption of supplemental doses of turmeric can significantly increase urinary oxalate levels, thereby increasing risk of kidney stone formation in susceptible individuals. This was published in the American Journal of Clinical Nutrition. But you have to take into effect whether you're using turmeric, the food, versus whether or not you're using the actual supplemental curcuminoid that do not contain anywhere near the quantity of oxalates. Who else should be cautious with turmeric? There are a couple of groups of folks that just want to go in to taking higher doses of curcumin with caution and preferably with good guidance from their doctors. And that one is the individual with gallbladder disease should be cautious. Now, I say gallbladder disease, not an absence of a gallbladder. So if you've had your gallbladder removed, this does not include you, but it's individuals that have gallbladder disease, gallstones, or what's called cholecystitis. Cholecystitis is inflammation of the gallbladder. High doses of, again, this is turmeric, not curcumin. So turmeric, high doses of turmeric, has the potential to trigger biliary colic. So it can actually trigger the gallbladder to contract. And if you've got stones in there, that can make you much more symptomatic. Now, this is if you're using high doses of turmeric, and not so much if you're using supplemental curcuminoid. You have to get really, really high. And I think in some research, it's like 20 grams. 20 grams a day is going to create a gallbladder contraction. And so supplementally, not so much a problem, but with turmeric, again, the food-based turmeric, you want to proceed with caution. Now, one of the other impacts that turmeric has that we haven't really talked about yet is it has an effect on blood clotting. So it can actually serve to reduce inflammation in the bloodstream and serve as a blood thinner, as a natural blood thinner. So if you're taking a blood thinner, you need to basically get with your doctor, your prescribing doctor, and talk about that and make sure that, if you're going to add turmeric supplements or curcumin supplements to your repertoire, that your doctor's aware of it and approves it and is monitoring you, and you also want to monitor yourself. So if you're getting too high, one of the things you're going to start seeing is pooled blood vessels in the skin. So you might have big, dark, kind of red, purplish bruises popping up all over your skin. If that's happening, your blood's getting too thin, and you should really talk to your doctor. But again, you shouldn't go into high doses of this stuff if you're on a blood thinner or you have a bleeding disorder without good medical follow-through or guidance. There's also some drug interactions that can occur with turmeric. And so blood thinners, as I just mentioned, but also diabetes medications and acid-reducing medications. The diabetic medications, because turmeric has an impact on insulin as well. If you're taking a blood sugar modulating drug or an insulin-affecting drug, and you're also taking a turmeric extract of curcuminoid that affects your blood sugar, you could get it too low. The point is you could go hypoglycemic and end up dizzy, passing out, and you don't want to do that. So if you're going to start something like this and you're on those medications, let your doctor know and monitor yourself and be cautious. So at any rate, that's true of most drugs. Now, some of you might be saying, I want to do this instead of the drug. Look, I can't tell you to do that or to not do that. That's between you and your doctor, but use caution. Turmeric versus ibuprofen. So what we know about turmeric in terms of its ability to help with inflammation and pain, there have been a number of trials in humans that show it to be an effective agent at reducing pain. It has a cumulative effect, meaning the longer you're on it, the better it works. And it's generally well tolerated, meaning most people tolerate it over long terms without having severe side effects. It's also suited for chronic management of conditions. So if you're one of those, a chronic pain patient, and you've been given every medication under the sun, this is something that you could consider. It has a very potent anti-inflammatory effect, and it works in multiple ways. It affects multiple types of inflammatory cascade mechanisms. Ibuprofen is used to manage pain and inflammation. The difference between the two really is ibuprofen works much more quickly, works within about an hour of use, and we could also say this of drugs like acetaminophen, it works quickly. And so whereas turmeric works a little bit more slower to take effect, but more effective long-term. It has a cumulative effect long-term. It works better the longer you're on it. But one of the problems with ibuprofen is the gastrointestinal and cardiovascular side effects. Anytime you block cyclooxygenase, which is what this class of medications do, there's a potential for heart problems, and there is also a potential for an erosion of the GI tract lining. So this can affect your stomach, it can affect your small intestine, eroding the mucosal layer, leading to things like GERD or leaky gut. But also, there's some nutritional effects of ibuprofen. We know it can cause vitamin C deficiencies. We know it can cause folate and iron deficiencies as well. So if you're using this long-term for pain management, you might consider talking with your doctor about using curcuminoids instead, or turmeric instead, or in lieu of, or to reduce your need for ibuprofen. I've seen cases where we can take somebody who's maybe using 800 milligrams of ibuprofen, we get them on a good 1,000 milligrams of turmeric, specifically turmeric extract with high-dose curcuminoid in it, and now we get a month in, even sometimes faster, we can take that ibuprofen down from 800 to 400, and then from 400 to 2, and then from 200 to none. So it's one of those things we can use to wean, that I sometimes do use to wean. But again, you need to do that under supervision, ideally. So how do you supplement? There are lots of ways to supplement. As I've mentioned before, there's powdered spice. This would be the whole turmeric itself. And then there are extracts and over-the-counter teas that can be bought that generally contain curcuminoids. This is what most consider to be the primary active ingredient that has the antioxidant and anti-inflammatory effects. Now, I would argue this is the one that's the most well-studied, curcuminoids, but there are at least 8 other compounds in turmeric that have been shown to have anti-platelet, any inflammatory and antioxidant effects. So I believe that there's more to turmeric than just curcuminoids. That being said, most supplements focus here on curcuminoids. A lot of supplements also will add black pepper or as an agent to enhance the absorption. Curcuminoids and turmeric is a water-soluble agent that's not super well absorbed by the intestines, and so using black pepper, piperine, you'll sometimes see as an ingredient on a supplement label, enhances the absorption of these things. Now, there's some science that actually argues that we don't want all that turmeric to be absorbed. We don't want all that curcuminoid to be absorbed. That actually a big part of its effect and its impact is right there in the gut, right there on the microbiome, which is what I showed you earlier. Turmeric's or curcuminoids' impact on bacteria, on yeast, on parasites, on virus, on biofilms. And so a lot of what we suspect a lot of its impact is right there in the gut. So we want to keep a good amount of it in the gut. We don't just want it all to absorb in the bloodstream, because the effect, remember, we've heard this saying, all disease ends and begins in the gut, and so we want a lot of that impacting the gut as well. So I would argue, and in my experience, because I've used both I've used multiple varieties of turmeric extracts clinically and seen that the ones that work better, in my experience, don't have this, don't have the black pepper, the bioperine, if you will, but are actually a whole turmeric matrix. So you get the whole matrix with a certain percentage of concentrated curcuminoids, but you get the whole matrix of the turmeric. And there's actually been some research studies on this that I'll share with you as well. So one of those being, you can see here, comparative oral absorption of curcumin in a natural turmeric matrix. So this is like a whole food matrix versus just concentrated curcuminoids. And so you can see the acronym they're using here is completely natural turmeric matrix formulation, so CNTMF. The extent of absorption of total curcuminoids in the blood for the CNTMF was 6 times greater than volatile oil formulations and 5 times greater than phospholipids. So a lot of these formulations now that are coming out with these fat-soluble versions, you can see that the matrix, the turmeric matrix formulation actually is absorbed in a better way and can be more functional, but it also stays in the gut. There are a number of different other compounds beyond the curcuminoids that have been shown to stay in the gut and have that impact on the microbiome, which is also part of what we want. Now, dosing-wise, dosing structure, you can go, there are studies that show that it's safe up to 8,000 milligrams a day for several months. Now, depending on what you're trying to accomplish, I find it to be super effective between 500 and 1,000 for most people. And as I showed you earlier, especially as it relates to the inflammatory markers like CRP and ESR, the 500 milligram, those studies were actually 250 and 500 milligram doses, and you saw that 250 almost had the same anti-inflammatory effect as 500. So I generally like to start people within that 500 range up to as much as 1,000, depending on their responses. Again, if you're on any type of medicine, work with your doctor, make sure they know that this is what you're trying to do. Make sure there's no contraindications in what you're doing so that you keep it safe. Another thing to consider, as you should consider with any supplements that you're using, is the potential for contamination of other things that you don't want to get exposure to. And so this was a study done on contamination of different turmeric and curcumin products that contained things that weren't on the label. In this case, it was cassava starch, wheat, barley, and rye. And if you're gluten sensitive or allergic or reactive to cassava, that's going to be a major problem potentially for you. So you always want, if you're buying, you want to buy from a highly reputable company that has advanced testing in place, because researchers have found a lot of these products to be basically contaminated on purpose, meaning the manufacturer of the product will put fillers in, wheat fillers, to add bulk so that they can sell more of it. And that's problematic for those of you that have celiac disease or, non-celiac gluten sensitivity. These, obviously you want to avoid wheat, barley, rye, and other grains, and you don't want to get a hold of a product that you're trying to take that has anti-inflammatory properties, but then you're being exposed to that contaminant that has inflammatory properties. One of the other things to consider with turmeric is the potential for lead and other metal contamination. So if you're buying a supplement, or you're even buying turmeric in bulk powder, this is one of the issues that we're seeing is the potential for lead and other metal contamination. So my advice, if you're trying to reduce your potential exposure to metals that aren't good and you're buying a supplement, it's not a bad idea to ask, do you do metal testing on your product? because companies that do metal testing, generally they're doing that to protect you from getting a batch of this powder that's going to be higher in lead and have the potential to bring problems to your doorstep. And I can tell you, just working in the supplement world, in the supplement industry, not all companies are equal. Many companies don't test. Many companies allow higher levels of these contaminants into their products and sell them openly. So you definitely want to make sure, again, if you're buying it, especially if you're buying it for medicinal purposes for yourself, you want to make sure you're getting a good product from a reputable company where they do testing, testing for gluten if you're gluten sensitive, testing for metals and other potential contaminants. So there you have it, crash course on turmeric. If you found this class helpful, let me know what you think in the comments below. If you've used a curcuminoid-based product and found it to be beneficial, chime in below. Maybe somebody watching and reading the comments below will find value in your positive story and your positive experience. Thanks again for tuning into Dr. Osborne's Zone. Hope you have a fantastic day. If you want the full master guide, slides, and research studies, comment turmeric below and I'll send it to you.